am now hearing that I always feel bad. I wish I had the late Len Hannon here with me, a Republican, because he and I worked very hard, and I forget when it was it 2003 or 5, to get a mental health bill passed by the Oregon Legislature. And so often when you do something like, and that basically means you look at mental illness the same way you look at physical illness, whether it's insurance coverage or at least the emphasis. You think, okay, we're there. Well, I've learned, I'm about to meet with DCBS right after this meeting, because there's a bill that that if we pass it, it's what the heck was it?
860.
860. It's in Ways and Means. It will say we need to have an analysis. I am getting signals that the private sector insurance companies are not treating it like we thought, either in coverage or in demands for coverage, and that basically we really don't have mental health care in the state of Oregon. Now, I want to get my facts right on it. So basically, I feel like, wait a minute, here we go. With this budget, we're going backwards, and we don't have mental health parity. And I have said before, in my opinion, if you would emphasize mental illness, the same treatment of mental illness, the same way we do physical illness, you would transform society. We would have a revolution in this country. And I know you don't believe that, but and I get it why you don't believe it, because you just don't believe it. But I can honestly tell you, you have no idea, the people sitting in this room, how much mental illness is all around you, even in this building, or maybe even in this room. Now, I don't know of anything. I don't know any of you that well, and it's none of my business. But I will guarantee you, somebody in this room is they're struggling with mental illness, or they got a loved one who's struggling with it. And I'm just going to say it because of the number of the people here. And so here we go again. We're gonna, I remember once fighting with a certain state senator. I'd love to name her, because she's very big on a big issue that you all know about. And she said to me once, that's what got me angry to do this, the gun issue. Well, Peter, I wish you wouldn't mention mental illness so bad, because we need to do the gun issue. And if you keep talking mental illness, we won't get to the gun regulation. And I said, Senator, and I will not name the senator, because, we want to help. And I said, and I don't know where it came from, the line. I know you don't think it's a good line. And I didn't make it up, except it came out of me somehow. I said, you know what occurs to me, Senator? Everybody wants to do something about mental health, just not today. And her look at me, she froze. And I got up and I walked out of that room. And you know what? That's exactly where we're going to go today. We get budget problems, so we're going to prioritize. And here we go. Here we go. I know it. I've been there. We've been there. We're going to slide. We're going to go backwards. Yeah, I know, Peter, but we'll get there. Just not today. And you know why? There is no strong, powerful lobby for mental illnesses in this state. And there's not in any state.